What are we going to be going over today? We're going to be talking about the cancer screening and primary sense with links to resources and step-by-step videos on how you can identify patients without evidence of bowel or breast cancer screening primary sense. We also have John Lee, Head of Engagement and Communication, Telstra Health, discussing the National Cancer Screening Register, and Tina Campbell, Managing Director of Healthily, and Nick Downing, Business Development. Some of you might have already met Nick before if you're using the GoShare bundles, but they will be doing an overview of GoShare bundles going to be made available to assist cancer screening activities throughout 2025 as part of the Queensland Cancer Screening Project. Okay, what is primary sense? Primary sense is a population health management, clinical decision support and data extractions tool that replaced the PenCS tool that the PHN previously provided to practices. It's currently being used by practices in our region as well as other PHN regions nationally. So if you haven't got Primary Sense installed as yet, please feel free to contact the Primary Sense engagement team and we'll be able to work through that with you. What are the benefits of Primary Sense? Primary Sense can assist you with your quality improvement activities and screening activities. Besides targeted prompts and medication alerts, many of the reports that come out of Primary Sense include an element of opportunistic care by highlighting who has the up and coming appointment, so you can see in advance those patients that are coming in and where you might like to target that care. Primary Sense also includes a lot more clinical detail about patients appearing on these lists, which helps clinicians direct care to those who warrant the most attention. So this is what the interface looks like. You get a report. To get a report, all you need to do is double click on the report that you're after. In this case, you would double click on the red circle bowel and breast screening report and you'll have a report within minutes. There's two different sorts of reports. You can see I've highlighted in yellow there. There is the reports that shows who's coming in, and then you've also got the practice PHN reports, which display some amalgamated information about the state of your practice and like diagnosis rates and overall patient complexity loads. So I've just got a QR code up there. You can scan that code to access the step-by-step video on how to identify patients without evidence of bowel or breast screening with using Primary Sense. We also have a feature in our monthly Practice Managers newsletter whereby we will feature a different video each month on how to use Primary Sense and various reports available to the practices. I'm not going to run through any of those reports today. I'm just aware that we've got quite a bit to get through with the other presenters, and we can help you with any of your Primary Sense reports at a later date. I would encourage practices to review Primary Sense the web page and to sign up for our newsletter for more information. And again, as I said, you can reach out to us at the PCE team in your region. We will send these slides out if you haven't got a chance to capture this information, and you can access it via these QR codes. So that's just a quick overview of Primary Sense and how it relates to the cancer screening. I'm just going to hand over to John now for him to go through the cancer screening register with you.
Thank you so much for having me and inviting me to talk to everybody today. I'd first like to start by acknowledging the traditional custodians of the land that I'm presenting from today, being the Wurundjeri people of the Kulin Nation. I'm down in Naarm, and pay my respects to elders past, present, and any Aboriginal and Torres Strait Islanders joining us today. Now, as Jennifer mentioned, I'm going to talk to you about the National Cancer Screening Register. So I'll start with a bit of an overview about what the register is and what it does, just to provide that context. And then we'll talk about some of the digital channels to hopefully improve access and submission of screening data for your patients. So the National Register is essentially a digital platform developed to support the National Cervical Screening Program, the National Bowel Cancer Screening Program, and it supports the programs end to end, the operations of the programs end to end. And essentially, it's really to help achieve those shared goals that we all have of eliminating cervical cancer by 2035 and being the first country in the world to do that, and saving over 80,000 lives from bowel cancer by 2040 if we can increase the participation rate to 60%. All the relevant legislation was passed in 2016 to enable the operation of a national register, and it's essentially creating one single record for each participant of the two programs. So you don't have to go to different registers in different states and territories to understand the full screening history. So the cervical screening program moved onto the National Register in 2017, so in line with the renewal of the cervical program, and the bowel program register came on in November 2019, creating that one record for each participant. So what does the register actually do? So it's not simply a repository, a data repository like a cancer register or a clinical audit register. It manages the full operations. So it essentially works as a safety net for the programs by inviting, reminding, and following up. So we start off by working with our Mailhouse and Sonic Healthcare, who's the contracted pathologist for the bowel program. And we send out around 1 million pieces of correspondence each month. So that includes the bowel test kits and letters and also SMS and email as well. And we have access to the Medicare database, which enables us to not just remind people to screen once they're already in the system, but also identify people that have never screened before and send them out invitations to screen as well. So once somebody has screened, we then receive the results from the labs. So we receive around 150,000 cervical screening test results each month, and histology results, and about 90,000 bowel program test kits as well each month. And they're directly ingested, all that data is directly ingested into the participant's record in the system. So we essentially receive those test results at the same time they go back to the provider, so the nominated healthcare provider. So the usual workflow in general practice or in ARCHO still occurs, that the labs still send results to the nominated provider for the bowel program and for the requesting provider for the cervical program. And those results are sent via the usual channels. So we also receive those results to act as the safety net. So we take those results and using the information held in the register and the new information from the results and any new information that's being provided by the participant themselves or the healthcare provider, use all of that information to make sure that the participant or your patient is on the correct screening pathway as per the clinical guidelines. So this then updates the recommended action, which then triggers the next action to happen. So whether that's be to just screen again in 5 years for the cervical program or 2 years for the bowel program, or potentially it could mean that the next action is a follow-up. So we may follow up with the provider themselves or with the participant, just to make sure that everything is happening as it should, as per the clinical guidelines. And then essentially all of that data is locked away securely and available to state and territory health departments, AIHW, Australian Institute of Health and Welfare, Welfare and the Federal Department of Health and Aged Care as well. And that's essentially so that the right people can access the data to make sure that program policy is still accurate and correct, and make sure that any changes can be made where necessary. Now, in terms of the digital channels we have available to access the patient screening information or to submit data to the NCSR, we've created these channels to essentially try and make it easier to access and submit data, but also reduce the need to call the contact center or call multiple labs to understand what's happened with that particular patient and what the screening history is. So we have the healthcare provider portal, which is available through PRODA and allows healthcare providers like yourselves to complete a range of activities. And we also have the integration with clinical software as well. So we've got integration available with Medical Director, Best Practice, and Communicare. And hopefully more vendors will come on board over time as well. So essentially, the functionality within PRODA and the functionality within the integrated system is exactly the same, pretty much. So you can access a patient's bowel and cervical screening results and histories and view the next action, submit program forms electronically, manage patients' details and preferences, and order bowel screening test kits. So the functionality is the same, but essentially when it's integrated into the clinical software, it's a little bit easier to access and submit because you're already in your software and you're in the patient record. You can open up the NCSR hub and view and submit the information within there. Whereas when you're accessing through PRODA in the healthcare provider portal, of course, you've got to go open up the browser, log into PRODA, and then enter in that patient's information in PRODA itself. So it's a bit of a simplified process when accessing through the clinical software. Now, in terms of access, once the responsible officer has integrated their system, that's then available to everyone within the practice. But when accessing through the healthcare provider portal, you can do that with either using a Medicare provider number. If you don't have one of those, but you are, say, a nurse provider actually providing cervical screening tests, you can use your register identifier number, which is provided by us at the register. And if you don't have one of those, but you are a provider, you can apply for one of those numbers. And then the other option there is to apply to be the delegate of somebody who has a Medicare provider number and act on their behalf. Now, we'll move over to the next slide, which just gives you a bit of an update on how we're going with integrations and trying to essentially improve interoperability and integrate as many practices as possible. So we've got about 3,500 or just over 3,500 practices across the country that have integrated. And I'm pleased to say that Queensland in general is really leading the way. Don't look at ACT. ACT always has really great numbers when it comes to integration for things like this, but Queensland is really leading the way in supporting practices and making sure that as many practices are integrated as possible, because I think Queensland has really understood the benefits of the integration and having easier access to information. And you know, the PHNs, like Northern Queensland PHN, have been supporting practices to onboard. We can also see some improvements in some of the data. So one stat that I really love is that we used to get about 8,000 cervical screening history requests by fax a month. And now that's about 270, which is a huge reduction. And it's essentially because people can go into the PRODA or the integrated system and get the information that they were requesting by a fax before, and they can do it in real time. They don't have to fax and then wait for the fax screening history to come back. They can access it within the system. So we're seeing some really great responses to, I guess, the advancement in access and submission of data. And we're seeing that more and more clinicians are submitting data to the register electronically as well. So there's forms that are built into the integration. For example, if one of your patients has a positive IFOBT program test kit, there is a form in there to inform the register when that patient has been referred on for a colonoscopy or for the next action, and that can be submitted electronically. I'll move into the how. So if you are a practice that is yet to integrate but does have either best practice medical director or communicator, there are a few steps to go through that registration process. Now, for those of you that have done it, obviously you know that it's just that a one-off registration process. You only have to do that once within Proda, and then you've got access within your clinical software. But there are some bits of that registration process that can trip people up a little bit because it's quite in-depth. So some of you may have already gone through a similar registration process when going to AIR or registering another piece of integration. So it might be quite straightforward for you because you're familiar with it, but for some it's not as straightforward. So essentially, the person that is integrated needs to be the responsible officer. So that's generally the principal GP, the person that has the HPIO details, the ABN details. You need all of that ready when going through that process. Now, to assist in supporting people to go through that process, if it's the first time you've ever done that before, we have some resources available. We've got a fairly new resource, which is called our Primary Care Onboarding Toolkit. And we've tried to make it as simple as possible to integrate. So there's a couple of slides for each of the vendors' software. Let's take best practice. We've got how to register the practice. We've got written support materials, but we've also got the full process documented in videos. So if I click on there, it will take you to walkthrough video guides. Now, everybody likes to learn differently. Some people like to read a user guide. Some people like to watch a video. Some people like to be walked through it completely. So the other option that we have is for you to essentially fill in a quick form to book in a callback. So if you click on this link, you can say that I'm wanting to connect my practice software. I'm available next Friday because that's when I do all my admin, and I want to call back at 2 o'clock. One of our team will call back and essentially hold your hand through that whole process and walk you through it, because it is tricky for some, especially if you're very unfamiliar with Proda and registering a HPIO. Our team, as you saw on that slide previously, the team have supported thousands of practices to register, so we should hopefully know all of the sticking points and be able to walk through each of those. Now, there is some other information in this resource as well, a little bit about each of the programs. So for the bowel program, there is a link to a video showing how to complete the kit. That can be quite useful if you've got the patient in front of you and you are just ordering them a replacement kit because theirs has been lost or it's expired, and you can show them that video of somebody essentially completing the kit. We've also got the clinical guidelines, and we've got some information for the cervical program as well. So we've got a video on the self-collection, a bit more information on self-collection for the CST, and some other bits of information there too. Now, once you've registered, and you've gone through all of those steps and you've ticked all the right boxes in BP or medical director and communicator, then we've got a bit more information on getting the most out of the integration as well. So there's a video here. Now, I will let you know there are videos for each of the vendor softwares and showcasing the NCSR hub, but they're a bit old. So we're developing new ones right now. They're just not quite ready there just yet. There's a case study to show how other people have used it, and we've listed all of the forms. Now, what I really wanted to do today was also provide a live demonstration. And of course, whenever you're preparing for a live demonstration, the environment goes down. So my backup is that video that we are creating that is not quite ready and signed off, but I can show you little snippets of it, which will hopefully help. So we in best practice. So let's take best practice as an example. We've searched for participant. We're in the participant record. We go to view. We go to NCSR Hub, and we can bring it up there. So this is where you see the patient details across the top. You can see what programs they are participating in. We can see the screening status there too. So for cervical, they're actively screening. Last screening date was March 2023. And we can see that they're overdue for the next action. Sorry, I should pause this. So we're going into foul there, overdue for screening, and they've never screened before. I'll pause this because I don't know what it's going to do next. But essentially, all of the screening activity that has been performed by that participant and any forms that have been submitted is available in this NCSR history view. So when you click on the screening history, this is the thing I talked about before, you know, the 8,000 faxes requesting a screening history previously. Well, now you can just open that up there and it brings up a document which shows the full cervical screening history. And this is a test patient. This is not a real person, of course. As you can see, their name is first name, last name. But this shows some sample reports that may have been submitted to the register about this patient. So GP assessment form, colposcopy data collection form, it's all listed in the history. Now, in terms of forms and submitting forms to the register, you would click on choose a form here. And if I skip forward to forms view, you can see all of the forms that are available there. So as an example, I've got a patient in front of me right now, been talking about bowel screening because I can see in best practice that they're due. And we've had a discussion. They now want to actually screen, but the kit that they got sent was quite a while ago and it's expired. So I want to order them a new kit. Now we can click on replace FOBT kit request. And essentially it brings up a really short form which says what's the reason they want a kit, and there's one other question: are they in a hot zone? And then submit. And then that form, that kit is then going to be sent directly to the patient's address. It's always good to make sure that the patient address in the NCSR is the one that you've got on record as well, and it's the most up to date. But we do receive updates from Medicare on a daily basis around addresses. So if it's up to date in Medicare, we'll have that information. Now, you may have also heard about the alternative access to kits model. So what that enables a healthcare provider to do is to go into PRODA, go into the healthcare provider portal, and order kits in bulk. So you can order kits in bulk to be delivered to your practice. Some of you may have already done that. We recommend ordering no more than 30 because they do have an expiry of 7 months. And then you can issue those kits to the patient in practice. There's a really important step that you need to take when doing that, and it's to open up this alternative access model form. Now that form name is going to change because it's not the best name. It's going to change to kit issued by healthcare provider. So that will change actually this weekend. We're having a release this weekend. So you would go up to open up that form and fill in the details. Once you've filled in the details, you would hit print and print that form and give that form with the kit to the patient. And essentially that's the participant details form that you would usually be included in the kit. Now, the reason why you register on here is because the kits that you have received in bulk, we don't know who they're going to. So it's important to register that that kit has gone to this specific person, and also, you know, making sure that they're actually eligible and haven't just screened. If they're not eligible, and they have, say, they're just screened and they don't need to do a kit, this form won't appear. It's not that the system's broken, it won't appear because they're not eligible to do that kit in that way. Now that's probably a fairly comprehensive overview. There's lots of forms, but I would encourage you to take a look at that guide I showed earlier. Also, once you've integrated, just have a play around and take a look and see how it works best for you. I think that's probably it, unless there's any questions.
No questions? It's fine. If you do have some questions or think of anything a bit later on, just contact us and we can pass that on to John. Okay, so I might just hand over to Tina Campbell now and Nick to talk to you about the GoShare bundles.
Thanks, Jenny. Hi, everybody. It's great to be here and thanks for the opportunity to talk to you all about the use of GoShare for the cancer screening project that will be conducted in 2025. What I would like to do is just give you a little bit of background now on the use of GoShare and then hand over to Nick, who will show you, some of you may already be familiar with the way that GoShare is used in practices to send information and education to patients. But he will run through the use of the best practice integration and speak about other ways as well to effectively recall patients, but in the process of doing that, provide people with education and information as well to give them reassurance and confidence and information about why it is that they're being invited to participate in cancer screening. Yep. Just to set the scene, we have done a lot of work in cancer screening with GoShare, and one project that comes to mind that I thought I'd share with you is called the Smart Screen Trial, where we have partnered with the University of Melbourne, and it was a trial conducted in Western Victoria to encourage people to participate in the National Bowel Cancer Screening Program. So the GoShare was used to send information to patients, and the results were very promising and have led to a larger trial that's underway at the moment. But the result was we saw a 16.5% increase in completion of participation in the National Bowel Cancer Screening Program on the back of receiving information from the GP or from the practice, encouraging people when they were about to turn 50 and 52 and beyond to complete the kit. So I thought that would be very relevant to share with you today. I'll just move on to an approach we're taking, and I'll just go into slideshow mode. The approach that we take with the sending of information to patients via GoShare and via the approach that you'll see from Nick at the moment is a very targeted approach to communication and in terms of the screening program, this can apply to bowel screening, cervical screening, and any other cancer screening opportunities that might be taken up in 2025. But initially, it is a very targeted communication. Nick will show you the way we go about it with best practice, but if you're not using best practice, there are other ways to identify that list of patients that are eligible to be communicated with, to either be recalled in for cervical screening or to be provided with information and encouragement to complete, for example, bowel screening. So initially, a link to information is sent via SMS. So it's a SMS message with a link that takes a person to a content page and provides education and information, but there's also a very strong call to action, whatever is appropriate. So we would work collaboratively with Northern Queensland PHN and others to develop the appropriate educational material for the cancer screening project. Now, if patients don't tap the link in that SMS message, they then receive a heads up message that says that they are about to receive a phone call. This is the introduction of the use of conversational voice AI. It's a rules-based approach that delivers a phone call to patients. It's an outbound call, but the patient also has the ability to call in and access information. But then a phone call is made 10 minutes later to provide information around the cancer screening topic, whatever the particular recall is. So the reason we take this approach is because we're absolutely driven here at Healthily to deliver equitable access to patient information. And what we know, and I'm sure we're all across the fact that not everybody is comfortable accessing information via a text message. There are digital literacy barriers. There are other reasons and barriers around accessing digital information. And so when we're wanting to really communicate effectively with a broad audience, a broad target audience, providing both options, it's a multimodal approach where patients can access information via the text message, but alternatively can receive the simplicity of a phone call with information. We've been delivering this, and some of you will be aware, and I'm sure Nick's engaged with some of you for the My Medicare project, but just to give you a sense of how receptive patients are to this approach. 25 practices up to 25th of August in Northern Queensland had participated, and we were seeing across 15,500 patients around a 22% open rate of the text message. And then when the phone call comes through, we're seeing around about a 28% open rate across nearly 11,000 people. For the phone call, an open rate is when a person answers the phone and confirms their name. So the overall open rate for the entire project, for the protocol, is 42%, which is a really strong engagement rate. And very briefly to touch on what we're seeing across age groups. Under 70 years of age, we're seeing 21% SMS open rates and 27% engagement in the phone calls. Interestingly, 70 to 80-year-old age group, we're seeing slightly higher SMS open rate, but significantly higher engagement with the AI phone calls. So I might, on that note, just hand over to Nick now, and he'll run through GoShare PSI, which is one example of how you can send this approach to your patients.
Thank you, Tina. This is just a little demo environment of a practice manager's best practice installation. We've got GoShare PSI installed and integrated with best practice on the right. Those of you that I've sort of worked with and we've completed the My Medicare send will know that it takes about just 2 minutes to download the app from our website and then turn on the integration in best practice, which is just a matter of going to setup, configuration, database, third-party integrations, and searching for GoShare, and then just ticking that tick box. So as we're still a partner with best practice, integration is pretty quick and simple. Generally, IT doesn't need to be involved to install this app. It doesn't require administrator access. The only times we need to usually involve IT is if your best practice is a remotely hosted environment, so hosted in a data center. Sometimes they're a little more locked down, but 90% of the time it's a pretty quick process to get GoShare PSI installed. In terms of the process to run the query and filter to find your patients, we pre-write all of our queries for use by the general practices. So for the cancer screening, this is just a sample one that I've whipped up today, but we might direct you to double click on the cancer screening query, the cervical screening. In this case, it's searching for patients that are active patients who have visited twice in the last 2 years and have not completed a test in the last 2 years. So if we run that query, this will then display a list of matching patients from your database. My screen's just turned off. 1 second, it's back on. You've got an option here to exclude patients who have opted out of electronic communication, or manually untick those that you know you're about to speak to or you'd prefer not to send that message to. We then choose to send the bundle to the list, give it a name the activity, and then choose to, we then load the pre-built bundle of content which we'll be sending. So that will be an education package which will include perhaps an interactive video or an animation or just some engaging PDFs or websites to view. And so that'll display by default, and then we'll choose to send this by SMS. The SMS message that the patient will receive will always drop in their first name and the name of the general practice that it's being sent from. So we find that really increases engagement and trust from the patient's perspective by dropping in their first name and their practice. And also, in some cases, we also drop in the phone number of the practice as well. Again, just to sort of increase the chance of the patient sort of trusting where this message has come from. A really nice extra feature as part of our best practice integration is the ability to set up this split send. So we're fully aware that no one wants to send out 500 SMS messages on a Monday morning at 9:30, encouraging patients to call the clinic. So we've got the ability to break up your maximum number of patients to contact into a smaller, more manageable number and schedule the future sends once a day or once a week in the future. So if this cervical screening search was to return, say, 600 eligible patients, you might let us know that you only want to contact 100 at a time. We'll build that into the split send settings, and then only 100 patients will be texted and called over the coming weeks at a particular time and day that you prefer. So that works really well to sort of spread out the sort of patient outreach and reduce the impact to the reception team with those extra phone calls that will inevitably occur. And then we'll hit send bundle. Last little step that we've got built in is that it'll give you a quick preview. It'll summarize over how many weeks this particular send will occur. It'll then schedule everything up, and GoShare PSI also then writes back into the best practice database into each patient's clinical records to make a note that they were sent the text message on this time and this date and what was involved in that. So if I very quickly show you what that little note might look like. Under past history, you get a little note sort of made at a time and a date, what was sent. And then if you wanted to log into GoShare on the web, you could even do that to view engagement, so whether or not patients have clicked on those links. And then, as Tina mentioned, we would then have an automated schedule of the voice phone call to go out any number of days after that initial text message, only to those patients that do not click the link. Very much. That's really all from me. Thanks, Jenny.
Great, thank you. Do we have any questions about the GoShare bundles? Oh, everybody's very shy and quiet. That's okay. Again, if you do have any questions, please do not hesitate to contact us. We'll be more than happy to put you in touch with Tina or Nick, or address any questions that you have ourselves if we know the answers.
Jennifer, I've just remembered there was a couple of questions that were sent through prior. So I'll just cover off on those. There was one around a patient having a total hysterectomy, and how do they make sure that they don't pop up? The notifications keep popping up because they're not due to screen. There is a new form in the NCSR Hub which essentially allows the provider to notify us if somebody's had a total hysterectomy, and then that will update their clinical pathway. So that will stop that prompt in the NCSR. And there was one more question about hot zones. Now, of course, I'm sure you're familiar, the IFOBT kits are heat sensitive, so they're sent out in the cooler months. The question was around essentially when those hot zones are impacted and how often they're affected by heat. It's very it varies in northern Queensland. Some postcodes may only have hot zones for 2 months of the year, and others 10 months of the year. But essentially, that the person may be impacted initially for that first kit, but once they keep doing the kit and they keep getting a new kit every 2 years, it's essentially in the cooler months because they're screening every 2 years. So it kind of evens itself out in the long run.
Oh, so how does that go with like when the practice orders the kits, they only come in those months?
They can
as
do
well?
a clinical override. So it's at the clinician's discretion. So there's a prompt to say, is this person in a hot zone right now? And essentially, you as a GP, are you aware of the implications on the hot zone? And do you wish to proceed in ordering the kit at this time? So essentially, the GP or the provider can talk to the patient, give them the general instructions about making sure that it's kept cool, and you go to the post office to hand it in directly instead of putting it in the post box in a hot time and things like that. And if the patient's okay to complete it at that time.
Yep. Okay. Thank you. Did you have any other questions that were sent to you?
There were a few, but I think I've covered them all in the session, hopefully, unless somebody wants to put their hand up.
Jenny, I might just maybe ask Nick to speak to, he's covered off nicely the best practice integration, but if practices are using Medical Director or other clinical software, there's other approaches that can be taken to deliver the SMS to patients.
Thanks, Tina. Yeah, so we can certainly work with something as like an export from Primary Sense. So for those practices that use best practice or not best practice, Medical Director or something else, we can just run the report in Primary Sense, find those eligible patients, export those patients as a CSV, so sort of a basic Excel spreadsheet, and then load them into GoShare. So we can still work with other software as well. The best practice is just a little more of a streamlined approach. But if it's Medical Director, we can do the same thing. We can either choose to use Primary Sense, or we can also run searches in Medical Director for patients eligible for the cancer screening.
Fabulous. Okay, and we will let everyone know as things progress next year as to when we're rolling out the GoShare bundles for cancer screening. Very exciting. All right, so if there's no more questions, please just remember, if you haven't subscribed to our GP Practice Monthly updates, do so, just so you don't miss out on information and resources and opportunities targeted at practice managers and general practice. And I'd also like to take the opportunity to thank John, Tina and Nick for presenting today, and to wish everyone a Merry Christmas, and I hope I see you at our next Meaningful Mingle next year. Thank you, everyone.
Thanks so much, Tina.
Thanks, everyone. Thanks, Jenny. Thanks, everyone.
Bye.
Bye.